Well, research shows COVID-19 patients are more likely to have a vitamin D deficiency. And with so many people working from home, some even staying isolated at home, it's safe to say many aren't getting enough sunlight exposure. Dr. Andrea Arikawa, she's an associate professor from the University of North Florida, and she joins us to talk about why vitamin D is so important and how we can get it into our diet.
Lately, there are some studies that have been showing that COVID-19 patients are more likely to have a vitamin D deficiency. There's a study out of Spain that found that 80% of the patients with COVID-19 had a vitamin D deficiency. And also, it seems that those with vitamin D deficiency are at higher risk for COVID-19 death.
Now, why is vitamin D so important?
So one of the most established roles of vitamin D in the body is to support bone health. I think a lot of people know that already. It helps build bone mass. But another really important role is that is more relevant to COVID infection is that it supports the immune system to help us fight infection. And one thing that is fascinating about vitamin D is that it's the only vitamin that can be produced in the body upon exposure of the skin to sunlight.
And I think one of the questions really right now is, can everybody produce vitamin D? Because some people think, depending on your complexion or depending on your ethnicity, that it changes. But what can you tell us about that?
So everybody can produce vitamin D, but you are totally right that depending on the color of your skin and some other factors, that can really decrease the production of vitamin D. So someone with a fair skin could produce enough vitamin D daily upon exposure of the skin, like the arms and the face, to sunlight for about 10 to 15 minutes. Now, this time changes if you have darker skin and if you are always covering your body with clothing. During the winter months, we know that especially in states that are above the 34-degree latitude, in winter months, you just cannot produce enough vitamin D because the sun is too far away. And then, keep in mind that it's only 10 to 15 minutes of exposure that really is required for someone with a fair skin to produce enough.
And what's very interesting with everybody, me working from home, a lot of other people working from home right now, you're not outside as much, maybe as we used to when we were working in the office. So what are some of the things that we can do, take initiative to make sure our diet allows us to get some of that vitamin D?
Yes, with diet, it's a little tricky because there are very few natural sources of vitamin D. So the best natural sources are fatty fish like salmon, mackerel, tuna, and then you also have eggs and mushrooms, but the amount is much smaller, as you can see on the chart. So here in the US, most of our vitamin D comes from fortified foods such as breakfast cereals, dairy products. Orange juice also can be fortified with vitamin D. So I think it's a good idea to read labels of foods so you can make sure that you're getting some vitamin D from some of these products that you're purchasing.
All right, thank you, Dr. Arikawa. You can find this segment and so much more on our website, firstcoastliving.net.